colleagues, all a pleasant good morning to you wherever you are. It's a pleasure for you to join us on this Guyana Mental Health and Wellbeing Conference. And this morning, I have the pleasure in the capacity of Director of Vector-Borne Diseases, Dr. Horace Cox, of moderating this roundtable discussion with some distinguished colleagues. Basically, the platform will address the delay in discounting task. So this task assesses persons' ability to postpone gratification by offering a larger money reward if the person is willing to wait for it, also known as what we call time reward trade-off. So this morning, we have on this distinguished panel, Dr. Lawrence Amsel, who is a clinical and research psychiatrist and works with Christina Hoven as the Associate Director of GPEG. He has done research in suicide and in trauma, and his approach is to apply decision theory and game theory to psychiatry. Following him, we have Dr. Diana Rodriguez Moreno, who is a neuroscientist and assistant professor at Columbia University. She did her undergraduate in Argentina and earned her PhD at Cornell University. Her recent research focuses on neural mechanisms of trauma transmission and the effects of emotion on cognitive processes using functional magnetic resonance imaging. And lastly, we have Dr. Yael Cycowicz, who is a cognitive neuroscientist and an associate professor at Columbia University. Over the past years, she has been using different neuroimaging modalities to investigate neuronal underpinning of cognitive and perceptual functions. Currently, she is using neuroimaging modalities to understand the impact of trauma on cognition and mental health across the lifespan, its spread across generations, and its influence among family members. So I'm sure that you'll agree with me that we have quite a distinguished panel, and without further ado, I'd like to go straight into the presentation. I invite Dr. Lawrence Amsel, who will be presenting first. Dr. Amsel.
I just want to mention that for Dr. Cox, that it turns out there's recent literature showing that delayed discounting behavior on the delayed discounting task and the inflammatory reactions are connected to each other. So even though our fields seem very far apart, they're connected to each other, Dr. Cox. I look forward to discussing with you the interconnection between delayed discounting and vector-borne diseases. So, excellent. And so nice to, so lovely to meet you. To meet your face. So we're going to talk about the role of delayed discounting in development problems in psychiatry. And I think Dr. Cox already started my introduction. So here's the question of what happens in delayed discounting. It's a time reward trade-off. Again, as Dr. Cox so appropriately mentioned. So what if you had this choice? What would you do? Sooner reward is, the time is now, I'll give you $50 immediately. Or there's a delayed reward. If you're willing, in a month, I'll give you $100. And everybody think about what they would actually do. Don't pretend. What would you actually do in that situation? All right, let's discuss what delayed discounting is. Many of you might remember an experiment by Walter Mischel called the marshmallow experiment. He asked kids, you put a marshmallow in front of them and asked them not to eat the marshmallow for 10 minutes and they would get another reward. And the kids who were able to postpone that gratification, not eat the marshmallow, turns out those kids did much better over the next 2 decades that he followed them. So delayed discounting refers to the ability to delay gratification. Again, a key point that was already mentioned by Dr. Cox. That was a great introduction. Delayed gratification involves the conflict between smaller sooner rewards, like the one I showed you, and larger later rewards. If I wait, I get more, but I want it now, okay? So discounting a future reward assigns to that reward a present subjective value. And we'll talk about what this means. And the present subjective value gets lower the longer the reward is delayed. I assess people's discounting through a task. They make many such choices and we evaluate them. The delayed discounting task is probably the most important task that's used, that kind of an economic task that's used in psychiatry. It's been shown to be related to substance use, where people are show great impulsivity, and to anorexia, where people show the opposite. They're too patient, they're too focused on the future. So here's a possible mental process that takes place with delayed discounting. The problem is there are 2 dimensions, Reward amount and time of reward. These are two dimensions. But in general, when I compare things, I want only one dimension. So I need to convert these two dimensions to one dimension for comparison. So a reward is delayed is worth less. We all recognize that. It's less valuable to have $100 in your hand than a promise, even if it's a good promise, for $100 later on. So when faced with this choice, what do? What I do is I mentally convert the later reward into a subjective present value. So I say getting $100 in a week, that's worth 60, 50, 40, depending on who you are. That's worth a certain amount to me now. So think of that, the present value of a future reward. How much is it worth for me to know I'm going to get that in the future? Now, once I do that, then I'm comparing two values now. I compare the immediately available reward, it's an actual reward, and I compare the subjective current value. That is not a real reward, but it's a subjective value that I can compare because it's a number that I've discounted. When I do that, I don't have to think about time anymore because I've already included time in the subjective current value. Let's look at some sequence of choices I might make. I showed you one for a month. How about a week? Okay, same thing, $50 versus $100 in a week. Oh, how about in a month? What about in a year? What would you do? Well, here this diagram shows you what you would do. This diagram is, and notice no time actually elapses. This is in your mind when you're trying to decide how much a future reward is worth to you. So on this side, on the ordinate or the y-axis, we have the present subjective value, which is the discounted value. On this side, we have the delay, the waiting time. Notice it depends on who you are. A highly impulsive person, you'll notice that these things will drop off much more quickly. We'll go into detail. Here, for the impulsive person, the half value time, that is the amount of delay that cuts the value in half is 12 days. You see that curve on the bottom? That's the impulsive curve, right? At the 50%, the $50 mark comes in at 12 days. That means if I have to wait 12 days, this idea of the $100 is only worth $50 to me. So what are they going to do with that task I gave them of choosing between $50 now and $100 later? Well, it's 7 days. In 7 days, I'm not showing this on the graph, but it comes in right here. On 7 days, this future of $100 is worth $55. The way I experience that delayed reward for a week, if I'm an impulsive person, it's worth $55. I then compare $55 is what it's worth for me to wait and get it, and $50 is what I can get now. No, I'm going to say no and wait for it. What about the delay of a month? Well, at the delay of a month for this impulsive person, the original thing has gone down to $25. And again, nothing has happened. Time hasn't elapsed, but this, in my mind, this is what how the delay reduces the value to me. So it's only worth $25. Wait, if it's only worth $25 to me and I get the choice of 50, I will take the sooner smaller. I'll take the 50 right now. Same thing in a year, obviously. If I've done it in a month, in a year, it's worth $5, only worth $5 to me. What about the less impulsive fellow? How's it go for them? Well, for the less impulsive fellow, the half value time is 100 days. You see that here? Here's the 50. Here's the $100 mark. Here's the $50 mark. I'm now on this low impulsivity curve. When does that go down to 50? That's 100 days it goes down to 50. So at a week, I've only discounted this 100 thing by $95. I'm all the way up here. So am I going to take the 50? Of course not. The discounted value is worth $95 to me. $50 isn't enough of a reward to trade off. How about 30 days? Well, it's worth $75 to me if I'm a patient person. So I'm certainly not going to take the reward. What about a year? Well, in a year, it's down to $25. That's only worth $25 to me. In the year case, I will take the $50. So that's the difference between the impulsive person and the non-impulsive person. So that's the delay discounting thing, and I hope it explains how it works as a task. So we've discussed the possible cognitive work that it takes in order to make this evaluation, right? In my brain, I make this calculation. How do I do the discounting? Well, if I'm doing that in my head, that means that the reaction time it takes me to get my reaction to the question may predict what I do, right? Because if I'm thinking a lot about it or less about it, that may tell me which way to go. So the reaction time in delayed discounting has not been studied adequately. However, leading the way is the two other presenters have led the way, and they've included me. Thank you for including me. They've included me in this research, but they have led the way in looking at the reaction time. Now, in another realm, in perceptual decision-making, where I just have to say, this is bigger than this, or this is larger than that, or this is more yellow or more green, simple perceptual decision-making without rewards, the greater the distance between the stimuli, the faster is the reaction time. We know that from a lot of research. But we tested the hypothesis that it's different than delayed discounting because it also involves the impulsivity, and the choices may include a component of that impulsivity as well, and my reaction to reward, not just to color, but to an actual reward. We also had data from our subjects about how they reacted on a previous time, so I could look at them at that way. So what did we do? We had participants perform the delayed discounting task in an MRI scanner. We're not going to show you the imaging data today, just the behavioral data today, and we'll be putting out a paper on the imaging data soon. We had 20 individuals with a mean age of 22, and we did the behavioral analysis where we used a Bayesian generalized linear mixed effects model, and we tested how the proportion of choices, sooner, smaller choices versus larger, later choices, how those were related to reaction time, to the reward magnitude of the smaller, to the relative reward difference. That's the difference between the offered rewards. Also related to how much delay was involved. So, and then we included reward immediacy and framing, which are more technical issues. Second, we performed the same analysis, but with groups as additional factor, and the group was defined by how they did in the past time. Were they high discounters? That means impulsive, and 10 of them were. Were they low discounters? That means more patient, and 10 of them were more patient. Our results are shown here, and as expected, there was significant main effects with reaction time. There was also significant effects with SS reward, relative reward difference, and time differences. But our main interest is that there was a significant main effect with reaction time. And that means that the more time you took, the more likely you were to choose the later longer. The more time you took to do your reaction, it was showing me that all that cognitive work I was doing in getting to the decision that I would wait. Now, in my second analysis, we also included the group category. Were you impulsive in the last time we tested you or not? And it turned out that the discounted group was significant. The group thing was significant in the model, as was an interaction between the discounter group and reaction time. And again, the SS reward, the relative reward difference, time difference, those were all significant in both cases, but they're less our focus of interest. Let's see what it means about the interaction time. And these are the graphs with the reason the graphs are thick, because it shows you the error bars on the graph. You can see the lines, and then each of them has an error bar. Well, reaction time interacted with relative reward difference. What does that mean? When the choices had smaller reward differences, when the choices were closer together, the longer reaction time was associated with LL responses. The choice to delay needed more cognitive processing and needed more time to cognitive process. When the choice had the largest reward differences, then the probability of choosing the LL was less associated with reaction time. So in that case, when the money thing was strongly separated, people could make a quicker choice, people make a thing choice, but it wasn't as associated. The delay was possibly faster, so it wasn't related to how much time you spent thinking about it. How about reaction time interacting with the group? Well, the high discounters showed a steeper increase with LL choices. What does that mean? It means that the impulsive subjects, those ones, right, who had a tendency to take the smaller sooner, they needed more time to choose the delayed reward. They needed the more time. And the low discounters, the LL choices were less dependent on the RT. So we see that the data demonstrate, to summarize, that unlike perceptual decision-making, in delayed discounting, the reaction time is related not only with task difficulty, but also with individual discounting tendencies. The role of relative reward differences of the amounts of money being a big separation or a small separation was that for smaller reward differences, the longer the reaction time was associated with more LL. So then when the rewards were close together, I needed more time to conclude that I should wait, that I should come to the LL decision. Finally, based on the prior choices, the higher discounters, the more impulsive people compared to the low discounter, showed a steeper change in LL with increases in RT. What does that mean? That means my impulse was to take the faster choice, the immediate reward. And so those times that I took the later reward, my reaction time is longer. Why? Because I had to fight my tendency to take the short one, and it showed up in a longer reaction time, demonstrating possibly that there was a mental activity that was involved in that. And this again is the same a summary that a summary of the slide that I just went over this. Those were all of the ultimate findings. Thank you for your attention. And Dr. Cox, I think I'm going to stop sharing and we'll turn this over to a video tape. Diana?
Yes, thank you so much, Dr. Amsel. So yes, we now invite Dr. Rodriguez Moreno to share. Thank you.
Oh, okay. I'm sharing the video or the video is being presented by, okay. Thank you very much, Dr. Cox.
Click that, no, click the X box. Diana, click, yes, get the sound going.
Good morning. Thank you for inviting me to the Guyana Wellbeing Conference. I'm going to present today a study about delayed discounting on adolescents with and without a family history of substance use disorder. This study was conducted at the New York State Psychiatric Institute and Columbia University in New York City, and it has been recently published on the Developmental Cognitive Neuroscience Journal. Impulsivity is a complex psychological construct, generally described by deficits on planning, tendencies to act without thinking, an inability to wait, deficits of self-control, an inability to inhibit behaviors that may have negative consequences, preferences for immediate rewards. Adolescence is marked by impulsive and risk-taking behaviors such as fast driving, unprotected sex, participation in extreme sports. It's thought that these behaviors during adolescence reflect differential developmental trajectories of two brain circuits. One that is involved on reward processing and develops during early childhood, and another one that develops during adolescence and adulthood and is responsible for executive control. Therefore, adolescence is seen as a period with increased susceptibility for substance use initiation. Usually, substance use starts during early adolescence and then increases sharply up to age 21. However, not all adolescents will engage in risky behaviors to the same degree. Some adolescents have a greater risk of developing SUD due to genetic, familial, environmental, and social context. In this study, we are interested in looking at the effect, at the influence of parental substance use disorder into adolescents' impulsive behavior. In this study, we chose to look at preference for immediate rewards as a measure of impulsivity. This type of impulsivity can be assessed with a delayed discounting task, in which subject has to choose between smaller rewards available sooner and larger rewards available later. rewards are available later are usually seen as of lesser value than the same reward available on the present time. For example, $100 that can be obtained today seems to be of much more value than $100 that can be obtained in 6 months. The more the discount of the future reward, the steeper the discount, the more impulsive is the individual. In fact, it has been seen that in drug addiction studies, has been seen that addictive individuals have a very steep rate of discounted future rewards. The same steep rate of discounted future rewards has been seen on individuals who have started using drugs early on life. Therefore, it has been thought that maybe it's possible to use the discounting rate during the delayed discounting task as a marker of risk status for substance use initiation and progression in adolescents. Importantly, one of the challenges on drug addiction studies is to understand if the behavior and the neural sequence underlying these impulsive behaviors are reflecting changes that are due to the drug per se, or if these were already pre-existing differences with non-addictive individuals. Therefore, it's very important to do studies on drug-naive individuals. In this study, we use a delayed discounting task to assess whether adolescents that were drug-naive and with family history of substance use disorder have higher discount rates than those without such a history. We compare adolescents ages 12 to 17 during a delayed discounting task to assess behavior and brain responses associated with impulsive choices. Our sample comes from a previous longitudinal study of 750 families of low socioeconomic status living in the South Bronx of New York City. We assess family history of SUD by assessing the biological mother or father for lifetime or past year alcohol or drug use or dependence using the Composite International Diagnostic Interview that was assessed during the 2 previous waves as well as during the screening for this project. Based on that, on the family history of substance use, we had 65 adolescents that were positive for family history of substance use and 60 that were negative. These adolescents, 97% of the adolescents were drug naive, as defined as having consumed less than 6 alcoholic drinks, smoked marijuana less than 6 times, or used any combination of drugs less than 3 times in their lifetime. The substance use of the parental substance use was characterized by being 23% was drug use disorder, 42% was alcohol use disorder, and the rest were both alcohol and drug use disorder. As you can see on the table here, the characteristics between the 2 groups, the family history positive and negative for these demographic variables is the same. There were no difference between the groups in demographic variables. As I mentioned before, impulsive behavior has many manifestations. To assess other aspects of behavioral impulsivity than those that are assessed by the delayed discounting task, we also use the Variant Impulsivity Scale, or BIS-11. High BIS-11 scores have been associated with early onset of substance use and also greater likelihood of abuse and dependence later in life. The BIS-11 includes 3 subscales: attentional, motor, and non-planning impulsivity. As you can see here on the table, the 3 scales were not the mean value for impulsiveness for each scale were similar between the 2 groups, the FH plus and FH minus. SUD has also been associated with anxiety, and high trait anxiety scores on adolescents has been associated with substance use. Therefore, we also use the state and trait anxiety inventory that measures the current level of anxiety as well as the personal or trait anxiety. As you can see here on the table, also these two groups were not different for state or trait anxiety. As I mentioned before, in this study, we focus on measuring impulsivity as a preference for sooner, smaller reward over larger, later rewards on a delayed discounting task. We use a version of the task previously developed by Decker, Figner, and Steinglass on 2015. And on any delayed discounting task, subjects are asked to do a binary response for the sooner, smaller, or larger, later reward. And they are asked to choose based on their true preference. To enforce this behavior, we compensate the subjects at the end of the study, choosing the reward on one of the trials. There are several factors that can be manipulated on delayed discounting tasks. The first one is the amount of the sooner, smaller reward. As you can see here, the sooner, smaller reward are all on the bold letters of the bold fonts, and they are different amounts. The second factor that can be manipulated is the time difference between the sooner, smaller reward and the larger, later reward. That has been, in this case, it was 2 weeks or 4 weeks. The third factor that can be changed or manipulated is the difference between the two rewards, the sooner, smaller, and the larger, later. The relative difference between the reward was changed between 1% or 3% or 5, 10, 15, 20, and 50%. Finally, well, there are two more factors that can be manipulated. One is the time that the sooner, smaller reward is presented. As you can see here, it could be today or in 2 weeks. So the today, we call it the now, sooner, smaller, and the 2 weeks, we call it the not now, sooner, smaller. So this manipulation is important because it changes the immediacy of the sooner reward and increase. We believe that it could increase or distinguish some differences on subjects based on the greater immediacy of the reward. Finally, we have what we call the frame, that is how the rewards are presented. If the sooner, smaller reward is presented before or as a default, then that is called a delay frame. If the larger, later reward is present as a default, that is called an accelerated frame. Here we present the results of the behavioral data. The behavioral data was analyzed with the Bayesian mixed effects model, predicting the choice. So as we mentioned all the factors before, the ones that were more important predicted the choice was the sooner, smaller reward, the now and not now factor, the relative reward differences, and the time differences. In addition, there were two factors, the now and not now factor that show an interaction with the group, family history positive or negative, as well as the relative reward difference that also interacted with group. To understand how these interactions took effect, we look at the behavioral data closely at the interactions, and we can see here on the left side, you can see the actual data. On the right side, panel B, you can see the model. And the y-axis it shows the preferences. The proportion of the LL choices increases towards going up, and so we will have higher proportion of LL choices, of larger, later choices as we move up on the axis. That would be more less impulsive subjects or less impulsive choices, and the more impulsive choices will be close to the bottom of the y-axis. As you can see here, subjects that were family history positive of substance use disorder were much more impulsive than the family history negative, only on the now trials. So this difference between the now and the non-now trials actually was captured by the difference between the groups. On the other hand, there were no difference between the groups for the not now trials. Here we look at the interaction between family history status and relative reward difference. As you can see here, when the relative difference was small between the two rewards, then both groups, FH plus and FH minus, behaved similarly. However, as the reward difference increased, the FH minus group was able to switch and then go for the most advantageous choice, that was the larger later. The FH plus group behaved more impulsive and did not switch to larger later rewards and stay with a larger proportion of sooner smaller rewards compared to the other group. We also look at the brain responses associated with the behavioral results which is presented. First, we look at the difference between the two groups, since we have seen behavioral differences. However, comparing the two groups, we observe no difference on activation. When we combine both groups, FH plus and FH minus, to look at the activation for the now trials compared to the not now trials, then we see a strong activation for the now trials, those that were more immediate. And we can see the strong activation actually corresponds to activity on the reward circuits and executive control circuits. Part of those reward circuits, like the ventral striatum and the insula, were only observed at subthreshold levels. Okay, to finish the talk, I will summarize the results from the study. Adolescents with family history of substance use disorder chose sooner smaller rewards more often than FH minus adolescents, particularly for the now condition, the more immediate condition. FH plus adolescents are also less able than FH minus adolescents to change their behavior to switch from sooner smaller to larger later rewards as the difference between the rewards increase. There was no difference in brain activation between the groups. However, both groups of adolescents engage the reward networks and executive control network strongly during the now condition. These results suggest that the impulsive behavior that we see among FH plus adolescents is still not associated with brain changes or brain differences on these adolescents, suggesting that early intervention could reduce the risk for substance use initiation and substance use disorder. I would like to thank all my colleagues at the Global Psychiatric Epidemiology Group at Columbia University that made this project possible. A special thanks to Dr. Cycowicz, who was instrumental in every part of the study, Dr. Amsel and Czesla Postava, that share important insights about decision-making and statistical models, Mrs. Vista and Mrs. San, for the development and implementation of all the data analysis, as well as to our collaborator on the Netherlands, Dr. Figner. Thank you very much for your attention.
Thank you very much, Dr. Rodriguez Moreno. And now we transition to Dr. Yael Cycowicz.
Thank you, Dr. Cox. That is also a video, a pre-recorded video, correct?
Yes, that's right. They'll be uploading it now. They'll be sharing the screen in a few.
Thank you very much.
Sure.
Hi. Today I'm going to talk to you about behavioral and brain differences between younger and older adolescents performing a delay discounting task. This study was done with my colleagues Diana Rodriguez Moreno, Shashao San, Kelsen Bista, Larry Amsel, and Christina Hoven at New York State Psychiatric Institute at Columbia University Medical Center. Impulsivity, on its multitude of definitions, has been shown to contribute to a maladaptive behavior in children, adolescents, and adults, and often is associated with psychiatric disorders such as ADHD and substance use disorder. Therefore, understanding impulsivity and its appearance over the lifespan is very important. One type of task that is often used to investigate impulsive behavior is a delay discounting task, DD, in which a participant is asked to choose between smaller reward available sooner and larger rewards available later. Adolescence is a period with heightened risky behavior, and studies have shown that in a DD task, adolescents demonstrate more impulsivity in their choices than adults by showing stronger preference for immediate rewards. While prior studies compared children, adolescents, and adults in the DD task, it is still not clear how during adolescence period impulsive preference changes. Thus, we compare younger and older adolescents during a DD task to assess behavior in the DD task, as well as brain responses associated with the SS and LL choices. As older adolescents are more engaged in risky behavior, we expect to see a greater preference for SS rewards in the older than the younger adolescents. In addition, DD tasks engage both the reward and the executive systems. During the child-adolescent years, the reward system matures earlier than the executive function network, and therefore we expect to see greater engagement in the frontoparietal executive system in the older than in the younger adolescents. Our task, the DD task, there are many different types of tasks, is presented in this slide. We have 102 adolescents divided into two groups of younger, those who were between the age of 12 to 15. There were about 47 of them, and older adolescents who were older than age of 15 and younger than age of 17, and there were 55 of them. All participants performed the DD task in the fMRI scanner. In the task, the participants were asked to choose between a smaller amount of money available sooner, SS, or a larger amount of money available later. And on average, participants performed 144 trials in that task. There were some variabilities among the trials in this task, such that some SS was available at the time of the task immediately, and we call it a now trial, and half the trials were available in 2 weeks. In addition, the default options that is marked by the green arrow was in half the trials were the SS choice, and in half the trials it was the LL choices. The behavioral analysis included a Bayesian mixed effect model where the outcome SS versus LL choices was assessed as a function of the other task variables such as the SS reward magnitude, the relative reward difference between the SS and the LL, the time difference between the SS and LL availability, and the delivery of the SS, the now versus not now, as well as whether the default option was the SS or the LL. Importantly, for our question, we also included age group as another variable, and we also look at the interaction term of those variables with age group. MRI was, the pre-processing of MRI was as typical as in all MRI studies, and we used two types of GLM, one for each individual subject region of interest, and one for the whole brain analysis. The SS and LL responses were used as regressors. This slide shows the results of our behavioral analysis with the Bayesian model, and overall the most important aspect of it is that there were main effect of SS reward as expected, of the relative reward differences between SS and LL. There was also a main effect of the time difference. Importantly for this question, we also saw main effect of the age group, and we also found interaction between the age groups, meaning the older versus the younger adolescents, and the time difference. If you look on the right side of the slide, you could see that the older adolescents choose SS rewards significantly more often than the younger adolescents, and both groups show more LL choices for the shorter time intervals, or we can say it also the other way around. Both groups show more SS choices when the intervals was longer. In the MRI study, in the MRI results, we found that there was no significant difference between groups when we compare the region of interest. However, in the whole brain analysis, there is a pattern of more frontoparietal activation associated with selection of SS choices by the older participants compared to the younger ones. In conclusion, as expected, older adolescents chose SS reward significantly more often than the younger adolescents, while both groups chose significantly more SS rewarded at longer time interval. The greater selection of SS choices by the older adolescents was associated with greater activation of frontoparietal regions. As these regions are part of the central executive network involved in saliency and working memory, the greater activation in the older participants suggests that differences between groups in choosing SS may stem primarily from differences in executive functions. Thank you.
Thank you very much, Dr. Cycowicz. So, colleagues, this has been a very enriched discussion thus far. We have 5 minutes that we can entertain some questions. I see one question already in the chat, which is from Nicole Cole. And this one is to Dr. Moreno. Our question is, did any of the imaging brain studies focus on the amygdala, and how DD-TAS would affect same? Nicole, did I get a question right?
I'll take that question.
Yes,
so,
please.
Yes, we did for the first study, the one on adolescents, looking at the different groups, the FH plus and FH minus, we did a whole brain analysis. We did not do a region of interest analysis. On that study, we did not see much of amygdala, although it has been reported on some reward tasks, amygdala. Usually the focus is on ventromedial prefrontal cortex and other reward areas such as striatum. So we were not focused really on the amygdala for this task. For the other study, the one comparing younger and older adolescents, that Dr. Cycowicz presented, we did a region of interest analysis there, but we did not include the amygdala, as I remember. So no, on this case, the answer is no. The amygdala was not our main focus. Mostly we look at ventromedial prefrontal, ACC, precuneus, striatum, hippocampus, and frontal regions related to executive control.
Thank you so much, Dr. Moreno. I don't see any other questions in the chat, so perhaps I can ask a few. My first is to Dr. Amsel. So I wanted to know, now that we've assessed this and basically diagnosed the factors that contribute to whether persons may find the smaller, sooner reward to be more appetizing, my question is, if we're going to try to entertain persons to choose the longer term reward, do we at this point in time have any insights as to what we can use in order to kind of encourage them to make more considered decisions?
Yes, there are actually some interventions that have been tried, and what those interventions tend to do is they tend to make the future more salient, more more interesting to people. And the way you do it is you ask people. There's a particular technique, and you go take them through an exercise. You ask them to think about future events. For example, if they have children, think about when that child would get married. I want you to sit there for a moment. Imagine that you're at the wedding. Other future events, imagine when your child is going to graduate high school. So you take these positive events. You have to ask the individual what's going to happen to their lives in the next 5 years. You ask them to think about those future events, and miraculously, they do differently on the delay discounting task because the future is brought home to them as far more important than just in the abstraction. And this turns out, if I do that, not only do they do differently on the delay discounting task, but they do different on their alcoholism behavior.
Yeah, brilliant. Thank you so much. That's very helpful. And perhaps I can just sneak in one more question to Dr. Rodriguez Moreno. So considering Dr. Amsel would have mentioned and answered it in that way, I was wondering, as we deal with adolescents who are a bit more impulsive and have this sort of reflexive behavior, I was wondering, how could we improve their perception of rewards? Because especially those that are in the younger age group, how could we, are there any interventions that are known that we can work with them for them to improve their thinking process?
That maybe is a question for Dr. Amsel, that is the psychiatrist on the group, but I do think that it's similar to what he said, to improve the perception of the future reward as something more present and more salient. I think that all the interventions are changing the salience of the reward. On the future, usually is much less. And adolescents tend not to think of the future. We know all that, especially the ones that have kids that are adolescents. We know that it's very hard to reason with them. I think that making them see the future as something more relevant, it can help too. However, for adolescents, it's different because the time span that they manage, the experience that they have is different. So there is something important that sometimes is kind of, we miss on this task, is like thinking how people perceive time differently at different age of development. Like children have very short perception of time, and as we age, we have a longer perception. So that is something that we also need to take into consideration. Dr. Amsel, do you want to add into something specific for adolescents on changing the reward salience for future?
Well, the latest kind of has helped us very much understand adolescence, as has the kind of brain imaging that Guyana is doing, which has shown people in the developmental thing that unfortunately in adolescence, the appetite, right, my desire for immediate reward, that part of the brain that focuses on reward is more advanced in development in adolescence than is the control portions of the brain, right? So my appetite is stronger, but my controls are weaker. Then when I get to be about 19, 20, 21, the control portions kick in. So adolescence in the brain regions that are controlling these things is exactly what we would expect it to be.
Excellent, thank you. There's one more question coming from the audience. So this one is from Padmini Roshandat. She's asking whether thinking positively about the future also would have individual confounders such as hope, for example, in depressed persons that exhibit hopelessness. I'm not sure whether it might be clear or whether...
No, maybe clarify the question. I'm happy to.
Sure. Admini, could you go ahead, please, quickly? Let me see. Padmini, we can't hear you. You're still on mute if you're trying to speak.
Hi, sorry, I was gonna type, but I think speaking is faster.
Yes, please.
So I was thinking in the studies in terms of the defining impulsive or measuring impulsivity and delayed gratification, wouldn't the study also, in terms of individual confounders, the actual study participants, whether outside of like adolescent age, in terms of adolescence, wouldn't a person who is, say, having depression or that is currently diagnosed with major depressive disorder, one of the symptoms or one of the feelings that is experienced in this disorder would be hopelessness. So would that, like, did they find anything regarding like hopelessness leading to more impulsivity? Because when you're hopeless, you probably don't think that far into the future or don't have like a positive thought about long term.
Yes, so I would answer that question because I'll answer that question, please. I have a talk tomorrow on suicidality. And I talk about the hopelessness involved in suicidality and how that relates. I can answer the question how that relates to delay discounting, and we'll be in that talk tomorrow. But the short answer is you're right, and there's enough research on this. Hopelessness should be associated with discounting. So things in the future are discounted. When I'm hopeless, it's not. So you say to somebody, oh, you're depressed, you feel badly, but you know what? Your daughter's going to get married next year. Doesn't that bring it? Well, that's discounted in depression more than it is for people who are not depressed. So the future is discounted, and that may be that's a very interesting observation on your part, and you'll see it works out in my model if you are able to come to tomorrow. But that, I think
thank you very much.
But it's an important insight that you brought to our attention.
Excellent. Thanks so much. Unless there were to be other questions, I'd like to thank the panel, very distinguished panel. It's been a pleasure. Very insightful conversations, which would have encouraged us to think differently as we approach this. So thank you all. It's been a pleasure and looking forward to continuing the discussions as we move forward.